in the mold world, we tell people that it's really hard to heal if you're still living in the mold. So that's number one. Test your home, test your car, test your workplace, and remove yourself.
We're here today with Darrah Kempka. She's joining us from Texas, a functional nurse who has firsthand experience in just watching the body's innate ability to heal. We're really going to hone in today on all things mold. So this is Mold 101. If you or a loved one thinks you have a mold exposure or suffering from the microtoxins that come alongside of that, listen up, tune in. We're really going to talk about ways to detox from these mold exposures. So welcome, Darrah. Let's dive right in and talk about how you came to the title of functional nurse. From what we've chatted about in the past, you had a traditional upbringing as a nurse. So give us the story. What brought you to root cause healing?
Yeah, it's interesting because there's nothing like program or certification out there that really qualifies you to become a functional nurse. I wish that there was. Maybe one day I can work on something like that. That's definitely, I feel a little called to do that. But in general, I graduated from nursing school in 2010 from Baylor, and I was in conventional practice for 8 years before I ever heard the words functional medicine or integrative medicine or been introduced to any of the natural healing modalities. And it wasn't until I have 2 kids and my youngest one is 4. And when he was 3 months old, he developed pretty bad eczema where it was like bleeding and cracking of the skin. And, I tried all the conventional ways, antifungals. I put a steroid on his body. I mean, we tried all the things. I switched his pediatrician a couple of times just because they couldn't give me any solutions. And they just kept telling me that I'm probably more miserable about it than he is. And I couldn't take that as an answer. And so someone had mentioned to me, what if you removed dairy from your diet? And since I was nursing him, and it helped tremendously. And I just kept asking the questions like, why? How is this connected? Because in nursing school, they didn't teach us the gut skin connection or the gut brain connection and any of this. And so, I kind of self-studied into it. I listened to a ton of podcasts like this one. I started working with a health coach who introduced some of these gut healing modalities. I read books. I came across Terry Walls. And around that time, I was working in a neurology clinic, working with a lot of MS. And I started talking about it with my patients and implementing some just nutritional, like foundational things with my patients. And, I got to the point where I was weird at work. Like people called me the kale girl. And my neurologist didn't really appreciate me talking about certain things like, did you know Alzheimer's, you can recover from Alzheimer's or cognitive decline? And that was something that was so against the grain that I decided to go to the Institute of Functional Medicine website, find a practitioner near me, and just applied without any, formal training in functional medicine that I thought would be required. And I just happened to be right place, right time. Most of my nursing career, I've done infusion therapy in a conventional way with drug therapies. And at the time, this functional medicine practice, which come to find out happened to be a really well-renowned center for people that were dealing with mold toxicity. And they had just brought in a physician and he had introduced Ozone to the practice and needed an infusion nurse. And so that was my in, and I went in and I learned so much so fast. I had an amazing mentor, and I was really busy since it was a practice that was already established. And so I got to see really cool things really fast. And I did take courses through IFM. And by the way, you can become a certified functional medicine practitioner as a registered nurse. And so that is an option for nurses out there. And so that's just kind of how I got to where I am today.
And when you say IFM, do you mean Institute of Functional Medicine?
Yeah, correct. Yep. And so that's one, kind of avenue in this whole integrative health. There's different certifications out there and different programs. And I talk about it a little bit more on my Instagram, and feel free to reach out to me if you're a nurse and you're interested in doing this. I have a lot of people nurses specifically reach out to me who want to know how to do what I'm doing. And I feel so called to kind of go that route next. And I'm excited to do that. So if you're a nurse, let me know, and I'd be happy to help in any way.
Sure. And we will put information in the show notes too that can link to your Instagram, to your actual clinic. But I did want to say, I find it so interesting that you had to come through to this, to integrative medicine authentically through your own family, your own pain. But it doesn't have to be like that, right? Per your point. It doesn't have to be like that. And we're speaking to a bunch of people who are maybe struggling with mold toxicity. So they're tuning in. It's really us as the consumers that can drive this movement of, we're not going to settle for just a pill to treat a symptom, right? Per your point, they might have called you the kale girl, but from a different angle, you were looking at nutrients that could help feed somebody and help get them to a place of health.
Starting with food as medicine. And yeah. And it's interesting. Sorry. I think, a lot of people in this space come to it because of a personal experience. But the more I talk to clients and people that are coming in without any experience in this area, I think innately we do have an inclination towards starting with healthy food and what we are putting in our body. And a lot of people don't want to take the pill. They just don't know what other options are, and they don't have access to this information, which is why podcasts are so cool.
And it's listening to your intuition, right? You kept saying, no, the steroid cream, this pill, this medicine, this isn't working for my son. My intuition is telling me there's something more. I should change practitioners. I should do this. I should look into this, right? Until it clicks. And so as consumers, we also get the opportunity to hear something on a podcast, digest it, and then say, what's our intuition telling us? Let's listen in and seek an alternative route, or get a second opinion, whatever that looks like, but never stop believing in the hope of healing, true healing. So you had mentioned the doctor that you worked under. He was almost an expert in mold toxicity, and we're here today to talk about mold toxicity. And as someone who has not experienced this, I just want you to paint the picture. What do patients go through? What does mold toxicity look like on an individual? Is it the same for everybody? Can it present different?
It can look totally different. There's definitely, some key things that if I'm working with someone who's totally new to this and hasn't worked with anybody yet, and I think in my mind, I bet that there is something underlying there with mold. And I often ask in consultation calls, have you ever been exposed to mold? And it's because 30% of the population has genetics that their body just doesn't detox mold well. And that explains why if there's a family in a home that has toxic mold, maybe one of them will get sick and no one else will get sick in the family. As sick, I should say, because the symptoms are kind of all over the place, from generalized like fatigue and just brain fog and kind of some of these symptoms that could look normal and common or are normalized and common, bloating, to a more severe where actually it is the root of a chronic issue or a disease like hyperthyroidism, even mental illness. And a lot of the clients that I would see at this practice that I used to work at, where it was like the mystery illness patient, where they've gone to all the doctors and they have all these symptoms and no one can really figure out what's going on with them. On paper, they look fine. And oftentimes these patients are given, antidepressants or anxiety medications because it's in their head. And so if that is you, then I totally encourage you to maybe look at this. And there are some things that you can do. There's tests you can do. Reach out to a functional medicine practitioner. And most of us are used to looking at this kind of thing.
So with that, because I'm listening to you and thinking, hey, that's me some days, right?
Sure.
Brain fog, bloating. That's me. That's me. So if that is me, hypothetically, what test where should I even start? And I want to get a little bit further into the actual symptoms of mold toxicity, but where do you even begin if this is triggering something in one of our listeners' minds? Where do you even begin?
So there's this amazing easy access test online. It's called BCS. It's a visual test. And the basis behind that is toxins like to live in fat cells. And so there is a layer of that behind our eyes. And so it changes your vision if it's a toxicity issue, or it can. And so we use this often as a screening tool. It's not a definitive diagnosis like, some of the other testing can be, but it's a good place to start. It's very cheap. You can access it online, and it's a series of questions, and basically it's a pass-fail. And so that's a good place to start. But there's also other tests that look at your urine to see if your body is excreting mycotoxins, which is the part that actually makes people ill. You have mold, but it's actually the tiny little spores that the mold shoots out that makes us sick. And there's so many different types of molds out there. I mean, so many different types, but there's specific ones that we know can make us ill or lead to chronic illness. And so there's different labs that test for different molds. You can test your home for mycotoxins, and then you can also test yourself to see if you're holding on to it. Is there another question in there?
No, that was just it of how do you know?
Yeah.
Right? Because again, the average American, the average human, I would say, is walking around with some of those symptoms you just listed. And I imagine there's almost a bell curve of severity of symptoms to where a lot of people do exhibit similar symptoms, but some are very minor and then some are very chronic and very serious. And so how do we know? Is you start with the first visual test, and that was called what again?
The VCS test.
The VCS test.
I can send you a link. Yeah.
Yeah, we'll attach that, guys, in our show notes. And then you can move to testing your home and your body. Is that through just urine or blood as well?
There's different ways. The Great Plains Laboratory, the GPL mycotoxin test, is a urine test, and that one is used quite often. And there's a few others out there. There's also different, I really like to use now this bioresonance test that can give us a whole bunch of information on toxins, but specifically mold as well. If you've been in a moldy home, and you have a known exposure and you're experiencing the symptoms, it would be a good idea to start looking into that.
Do most people know they live in a moldy home?
Not always. It can be hidden for sure, because it can live in the air ducts system. It could be growing underneath the sheetrock. And unless you know what you're looking for and you have an eye for that, you may not know at all. Or you may have grown up in a moldy home and maybe you're not in one now, but you're still, especially if you have the genetics, you're still holding on to those toxins, and just over time,
your body is not effectively detoxed to them.
Right. And a lot of people assume too that they're living in a brand new home or a brand new apartment. And, although maybe initially that might be, true that there's no mold in there, but things happen, leaks happen. And it's just not always a guarantee that a new home doesn't have it. So, especially if you know that you're someone who's very sensitive to mold or have the genetics, it's important to test your house, even if it's new. Yeah.
All right, let's dive further into mold toxicity and what that looks like specifically on the majority of patients, because there's got to be some sort of red flag, right? Or no?
Yeah, it's really easy for us. The more that I work in this population of people, it's easy for me to look at almost any ailment and say mold because everybody's been exposed to it at some point or another. I mean, it is everywhere. It's outside, especially if you live in cities where like humidity is high, and you old buildings and stuff. So, I mean, it is just so prevalent that it's easy for me to go there with it. But in general, fatigue, brain fog, hard time losing weight, those are kind of probably the top three, I would say, that's common amongst each of my mold, patients. But it can go anywhere from like, debilitating mystery illness to I have a problem concentrating in my job. And so it's just so common that it's easy to kind of, say every situation you probably have some sort of toxicity, whether it be mold, parasites, virus, because in functional medicine, what we're looking at is root cause. And so it typically falls under the bucket of what is your body deficient in? What is it lacking? And then why is it lacking? And then also, what is our body holding on to that we need to get rid of? Or what do we need to detox from? And so if it's not mold, it's, maybe a virus or a parasite or yeast overgrowth. And, there's definitely a good and better way to address detox, which we can totally get into here in a little bit. But a lot of times whenever we are dealing with a toxicity, we want to start with gut health and repair. And so, the good news is if this is something that you think, might be applying to you, and hey, I have fatigue and brain fog and all of that, starting with a good gut healing and foundational work is going to get you really, really far. And then if you need extra support, there are so many things, including the type of thing that I work with, which is Ozone, that's going to treat mold, but the same treatment is what we use for virus so it's not always, I just don't want to promote like worry amongst people that, I have these symptoms, I am full of mold, what do I need to do? And go super hard on the detox because, this is something that is very prevalent and very common. And there's things we can do on a super foundational level. And so it might not be as problematic for you being exposed to mold as it would be to that 30% of the population that has genetics that doesn't detox it well.
So what I hear you saying, yeah, you did. And what I really hear you saying is today we're honing in on mold, but let's say it is a chronic infection. We're so hyper-focused around the term diagnosis and I have this. And so I have to do A, B, and C, and D to get to health or to get to wellness versus just looking at the body. We talk a lot around symptoms versus supporting the system. And you're saying, hey, we just want to make sure you're detoxing effectively. Today, we're talking about detoxing from mold, but really your body just needs an avenue to detox. And let's dive in a little bit more to that. How do we aid our bodies into detox if our bodies aren't naturally getting out these microtoxins?
Sure. And I think that this discussion can be so foundational focused because there are a lot of things we can do that aren't as extreme as ozone therapy that work really well. And one of them is detoxifying your home. Because when you look at the total body burden, right? And so anybody who's worked with a functional medicine provider or a naturopath probably knows about the toxic bucket model, where your body has a certain amount of toxins that it can handle before you start experiencing symptoms. And, our body is miraculous and it is designed to detoxify. We have 7 detoxing organs. And so one of the things you can do is make sure that you're lowering the controllable toxins in your bucket and also optimizing your drainage pathways so that as you're introduced to toxins, because we all are in our life, we live in a toxic world and we can't escape it all the time. And so opening your drainage pathways and avoiding toxins in your products and in your home, toxic thoughts, working on just some foundational drinking clean water, breathing clean air, that's going to help you whenever you do get exposed to something like mold, not have such a severe reaction.
Okay, so there's things that we can do starting today in the house. And just when you talk about not having toxic thoughts, we can do inside of our own heads. But what about, we know we have a mold toxicity issue. We've had a mold exposure and we want to walk next to a functional practitioner, a functional nurse. What does that look like? What therapies? You had mentioned ozone. So take us through the journey of ozone therapy.
Sure. So I think ozone is so great and such a great tool that every home could benefit from for kind of the reasons that I was talking about before. So ozone in general is oxygen, right? It's an activated form of oxygen because it has 3 atoms of oxygen versus 2 atoms. And because that's an uneven number, it's unstable. It wants to donate that 3rd oxygen atom, which is a process called oxidation. And so these molds and viruses and pathogens in our environments don't have any threshold against oxidative stress. And so that is why they use ozone to purify water, to purify air, is because it is a germicidal. It will kill these molds on contact. So you can utilize ozone in your home by ozonating water and treating your surfaces with ozonated water. You can clean your washing machine from mold so that your clothes aren't being, exposed to that kind of pathogen. You can use it for insufflation therapy, which is where you take the gas and inject it into a body cavity, such as your ears and nose, to prevent, inflammation and infection there, or to work on inflammation and infection there. And then all the way to blood ozone, which is where we take a sample of blood, treat it with the ozone, and it creates an immune response. And that is a really nice healing modality where we can try to avoid the use of antibiotics and steroids to not only detoxify your body, but to create an environment in which things like this won't thrive in.
Now I have a question. If you're doing ozone therapy, but you're still living in a house that you have a unknown mold exposure to, will it not actually be a successful treatment?
Yes and no. In the mold world, we tell people that it's really hard to heal if you're still living in the mold. So that's number 1. Test your home, test your car, test your workplace, and remove yourself. And although symptoms may get better with ozone therapy, you're not addressing the root cause, because the root cause is the mold. So getting out of the moldy situation is step 1. I have clients where that's just not an option for them. And so I just let them know that this is going to be maintenance for you, and help with just kind of those acute situations, but really to invest your money and your time in your health, getting out is step 1 for sure.
Okay. So if someone has addressed their home issue or their mold exposure, because you said that this could happen from our childhood as well. So your mold exposure technically could have happened 20 years ago and your body genetically hasn't had the pathway to detox from it. So what happens? They come in, you get one ozone therapy. Is that a pretty instant difference in people, or does it take multiple treatments through ozone to actually heal?
Yeah. In my experience, it takes multiple treatments, and that just depends on so many things. And, I really strive to help support people to get the best benefit and to do it in a way that is maximizing your whole body, and so let me start by saying, again, I think I said earlier, there's a good way to detox and a better way to detox. And someone coming in wanting to detox from mold, but hasn't done any nutritional work, gut work, drainage pathway, binding, all of that, I always say, it's never just one thing. It's never just one infusion of ozone. It's never 10 infusions of ozone. It's a combination of things because we view the body as a whole. And I believe and have seen if you push too hard with ozone too fast and you have leaky gut, then your body is just going to reabsorb those toxins and you're going to feel worse. And so not only do I recommend patients to do like a series of infusions, I actually will recommend them to do gut healing, binding, draining, ozone, for probably depending on how they tolerate it as well, because there's different levels of ozone, different protocols. And so, we could have a big detox reaction or a Herx reaction, which we want to avoid doing. And we avoid that by starting with foundations and working your way up. And also, if we need to, go low and slow. So that might mean 10 to 20 infusions. If you're a person who can handle or you've done a lot of work with binding and draining, then you can handle the high dose options. It may take less infusions than that.
Now, when you say binding and draining, can you simplify those terms? What do you mean by the binding and the draining?
So in the mold world, there's a lot of different people out there that I follow and that I've learned from. And so basically, it's three things. It's kill, bind, sweat, right? So you have to kill the mold. You then have to bind to it, meaning it's maybe dead, but it's floating around in your body. And in order for your body to eliminate it, you use agents that are binding agents that bind to the mold so that your body can then eliminate it, because we still have to do that job. The ozone does the killing, but your body, we have to bind and then still eliminate it. And drainage is the elimination part. So I remember I was talking about that bucket, right? And so to drain that bucket, our body has different pathways of doing that. We have the lymphatic system. We have our skin sweats it out. Our GI, intestinal tract, moves out. Our kidneys excrete out toxins. Our liver processes toxins. Our lungs, we breathe out toxins. What am I missing?
I don't know, but this just makes for a cause to pause and just a shout out. I wish this whole podcast could just be around our bodies. Well, it is. Our body is amazing and it is so resilient and it works for us. And I just want everyone out there to think through that. Like our bodies work for us and we just need to find a way to sit and enjoy the ride, but help it along. But just listening to you say that, like the amount of detox pathways we have available to us, it's incredible, especially knowing we do live in a toxic world and there's a lot of that you can't avoid. That is just where we are at, but we need to understand that we still are in control of so many things and that our bodies work for us and they will detox. It's a beautiful picture.
It's amazing. And, they're really designed our bodies to do this. And, some of these things that we feel so inclined to do, like get in the sun and move around and eat things that are colorful, like all of those things are so like, we want to do them because it supports these like ways of healing itself. And it's really cool. Yeah.
I love that. Is there a patient that comes to mind, someone who came in, you guys together came to the conclusion it's mold toxicity, and then you saw healing and walk them through to the other side of just wellness? Can you share a story of, I guess, a success story with mold?
Oh, gosh, I'm so grateful and honored to have worked with so many. It's hard to choose. So, a couple OG clients of mine come to mind where I had had this lovely lady who was a mom of 5 or 6 kids, and she was a teacher and had to completely stop teaching and working. And she just felt like she was really missing out on her children's lives at a young age because she was just sick in bed, like didn't have energy to do anything, and just didn't get to enjoy life as she previously had been. And so she worked with many doctors and root cause doctors to eventually, ultimately find out that mold and Lyme were at the root of her illness journey. And so she did the whole functional medicine route, worked on diet, worked on gut, and then started ozone therapy. And at first it was really tough. She had the big Herxheimer reactions. And so we had to pull back.
What does that look like?
Yeah.
If you have a excessive detox reaction, what does that look like?
So it can be from anything mild to like mild flu-like symptoms, which is what the goal is. We don't want anybody to kind of get beyond that, because if you are, it just means we need to go back to some of the foundation stuff. But bigger Herxheimer reactions may look like, and I kind of don't really like dismiss anything negative from ozone being a Herxheimer reaction. If it happens within the first 24 to 48 hours and lasts 24 to 48 hours, it's typically a detox, a Herx reaction. And it's typically worsening of the symptoms that you previously had. So a lot of times, like, by the time they get to ozone therapy, they have done a lot of work. So they actually sometimes feel good. And this is like just a modality where we're getting a lot of it out. But maybe 6 months prior, they had been experiencing like fatigue and body aches and headaches. And so whenever we do these detoxing modalities, as we're getting the rest of it out, it'll be probably those symptoms just magnified.
That's interesting.
Yeah.
So anyway, back to this mom of 5 teacher.
Yes.
Has to quit her job and then finds your practice, finds you guys.
Yep. She found us, and she did all the things, and we started her off very low and slow. She ended up having Herx reactions. So we had to kind of pull back, work on some more foundational stuff, but eventually we kept, going, and we added the UV light therapy, which was a huge deal for her. So we were in the middle of ozone therapy when I went and got trained and we brought UV light therapy to our practice. And that was like a game changer for her. I think she's had some autoimmunity stuff going on too. So, and so now she's teaching again. And, I saw that she's gone on vacations with her family, and she's just, I remember her mostly because we created such a good community, and it was of moms. Like, there's so many moms out there who are dealing with this and missing out on their children's lives. And she was just such a voice in the community of, keep going, keep trying, this works, and that there's hope. So that's kind of why she sticks out in my mind. There was another client who kind of the same, where like, you have to quit your job because you're so ill, and then now you get to do that again. And she's an amazing vocalist. She's a singer, and she hadn't sung for 10 years and was able to actually sing again. That was really cool. I mean, That's
incredible. When you talk about the banding together of moms, and I want this to be specifically said that this is something that isn't just a woman thing, right?
Sure.
This is something that both males and females can be exposed to equally. But when I think through moms, I think through the journey of, it can be in your head, or, you're depressed. Mm-hmm. You mentioned the antidepressant, and not that can't happen to men, but I hear that so often with women of, no, you're just tired. You're just in a stage with your kids. It's like, no, it could be something deeper. It could be so much deeper. It could be mold. It could be so many things, but let's now walk with someone who's certified to do these infusions of ozone, who's certified to really walk with you and get to the root cause and develop what needs to be addressing your deficiencies, and also addressing what you need to take out, what you need to detox out. And I love that story, gives people listening hope, because there is so much hope. I feel it in your body language, just talking to you on this podcast, right? There's hope for you out there. if you're struggling and don't yet know what your quote unquote diagnosis is.
Yeah.
So with that being said, is ozone accessible? I'm sitting here talking to you in Texas. And if there's a listener out there that's like, I live in California, right. Is it accessible from a nationwide stance?
Yeah. So one thing is that I always want to tell people is anyone can purchase an ozone generator for home use for insulation and ozone water. So there are a lot of really great companies out there. So there's that. But also, to find a practitioner like me, I actually have worked with a company that has a long list of providers that they work with. And so if you send me a note or your zip code, and I can respond to you with a link where you put your zip code in, and the team will respond and give you a recommendation for a provider who does IV ozone therapy.
Guys, awesome. Just give our audience 3 things that they can do today for better health. Simple 3 things.
Yeah, I like to go back to foundation. So simple things you can do. And these 3 things are things that I practice. So, I know this works for me, and it's getting outside. Like anytime that you feel any sort of way that's not full of joy, get in the sun and just breathe. Take deep box breaths. Those are my 2 favorite things to do. And also, I would say journaling is another thing that I think is really helpful because, body, mind, spirit is such an important thing too. Like really working on mental, emotional, and limbic system work is really important too. And so I think journaling has been the number one thing that's helped me with that, along with going to therapy. But I think those 3 things are my top 3.
All right. So to the listeners out there, if you love this podcast today or found just it helpful in general, and it's triggering you to, hey, do I have mold toxicity? Is this something that maybe has been ailing me for a while and has gone undiagnosed? Please like or share this. Also subscribe to wherever you're listening to. And I just want to reiterate what Darrah and I had talked about. Find a local integrative medicine practitioner that you can advocate for yourself comfortably with, and that will really hone in on treating your specific system, your body, and not just the outpouring of symptoms that come along with some of these microtoxins. So thank you for joining us.